The topic for my presentation today is telehealth and its role in the management of healthcare during COVID-19. The focus of my presentation will be how or what role did telehealth play in bridging the social distance with the technological tools. So telehealth has been playing a major role in the management of healthcare. It was ready to play a role, fortunately, but it was not as widely used as we wish it to be of use. However, during COVID-19, due to the need for social distancing primarily, healthcare practitioners and healthcare systems began to give a more serious look into telehealth. In other words, the enforcement of social distancing measures had the effect of reduced technology distance, not just in healthcare, but in every other walks of life. In this presentation, based primarily on my own research and also the experiences of healthcare practitioners and other researchers that I interacted with, I will argue that telehealth has finally come of its age. It has become a matured adult rather than limping on someone else's help. It's time to move telehealth from the peripheries to the center of our healthcare systems around the world. It's something of a very formidable force that could make a significantly positive change into the healthcare landscape of the 21st century, the remaining part of the 21st century. To provide a little more context to the discussion, I will bring small caselets and examples from elsewhere, and I hope I wouldn't bore you for during the next few minutes. So I have done some research as early as 2007, 8, and 9. One of my focus at that time was how telehealth or telemedicine in particular has been making radical innovations in healthcare. Healthcare is generally known to be an area where innovations are resistant, just like the aeroplane cockpits. The healthcare practitioners are really careful about making mistakes, and even when technologies are available to use, it goes through multiple iterations before they get accepted by the gatekeepers. So anyway, telehealth over the last couple of decades has brought in a lot of fundamental, radical changes, not just incremental changes, radical changes into the healthcare landscape. Technology-driven health assessments have made prognosis and preventive interventions feasible for everyone. Until these technologies came, it would have been far more difficult, far more expensive, far more time consuming, far more resource intensive for ordinary patients to get diagnosed, to get prognosed on diseases. A more recent change is what we generally call the Internet of Things. Almost every subsystem within the larger healthcare system has been integrated into the internet by bringing in devices and connectivity. So advances in ICT, information and communication technologies, have made the healthcare system work more efficiently and in a concerted manner. The coming together of the internet, smart devices, health insurance companies, and accountable care organizations, that coming together has fundamentally changed our idea of what healthcare could be, if not is. Introduction of advanced robotics into healthcare means that not only consultants or consultations, but also sophisticated surgical procedures can be done remotely. In the earlier phases of telehealth, it was primarily used for prognosis and diagnostic and early consultations. However, as of now, that is passe. We have robots that could almost independently do advanced surgical procedures, and that is a major stride in healthcare. So, with the implementation of EICUs, electronic intensive care units, especially in acute situations, doctors need not be in the hospital premises. They could be in their homes, they could be somewhere else, and at the same time, they could remotely monitor patients who are admitted to hospitals or even in the post hospitalization phase of healthcare. Another big change is the use of big data. Big data analysis in healthcare has become more common recently. Among other things, this helps predict problem populations and patients in advance. Hospital systems could analyze larger populations and see mega trends in health, mega trends in diseases, mega trends in the spread of pandemics. Things are not perfect, but getting far, far better. This way, healthcare providers could better target populations for specific treatments. For example, it's probably easier to identify that a larger population segment exhibit characteristics that are indicative of, say, chronic heart diseases or diabetes. As of now, the problem is in gathering what we call big data. The big data is not so big due to various protective mechanisms and measures. With a greater integration of global level healthcare data, the big data could become vastly more powerful, and analyzing that big data could result in far greater insights. Another interesting thing that has happened in telehealth over the last couple of decades has been an integration with telemedicine, medical tourism, an integration with medical tourism. Typically, medical tourists need to make multiple trips to foreign destinations. An American or Canadian might have to fly to Thailand or Costa Rica several times during the consultative and treatment and post-treatment phases. Telemedicine typically avoids a lot of these trips. Generally, this means that the patients need to visit those hospitals in foreign locations only once or twice during the major surgical or procedural phases. So telemedicine has complemented another growth industry, medical tourism. Of course, coronavirus has put a pause on all those things, but hopefully everything will be back to normal soon. With that in background, I would like to come to some of the observations I made as part of a larger project in connection with COVID-19. So the available evidence that I have, I should stress the word anecdotal, because these are not large-scale studies and these are not following very systematical statistical procedures. However, these limited evidences indicate that telehealth did play a very major role in handling COVID-19 situation in several countries in the world, not just in developed countries, but also in developed and underdeveloped countries. As a result of the social distancing measures enforced during COVID-19, there was no other way. Technology needed to be brought in to relate with patients, give them advice, get their statistics, their essential healthcare indicators, health indicators. Quite positively and surprisingly, in China, the Chinese healthcare had already deployed something called ETCS, Emergency Telemedicine Consultation System. This was not in anticipation of COVID-19. However, this was a great use. This was a great boon for healthcare practitioners and hospitals. Israel and Japan are two other countries that I have noticed they have used telemedicine to provide care to infected passengers stranded on cruise ships. These cruise ships that were floating in the deep oceans, not allowed to land, I mean, not allowed to anchor near the ports. That had become a major scare, that had become a major international news. However, based on available evidences, we could see that Israel, Japan, and even to some extent Cuba, of course, embraced in a more active way. Israel and Japan gave consultations to these patients by means of technology that becomes part of telehealth. Likewise, the infected sailors on the US Navy ships too received extensive telemedicine support. At least 10 US Navy vessels reported significant outbreaks recently, and of course, this data is not entirely accurate. There has been a lot of conspiracy websites floating with different kinds of news. When we talk about telehealth, it doesn't mean everything is fancy and world class. Every country has used it in some way or the other. For example, Cambodian example, they have used it to treat people in remote areas over emails or uh, even text messages. These are not the best, most up-to-date use of telehealth processes or technologies. However, some way these technologies are being used everywhere. Telehealth technologies became the back end of several social media apps that have come up to help identify and trace people and who all they contacted in their travel histories. Some of these screening algorithms were powered by artificial intelligence, and human interventions were not really needed, and that was something very new. Many of us are could not even think about such an integration for contact tracing. So based on the predictions that AI makes, those who own these apps on their smartphones and other devices would get consultations and possibly appointments remotely, automated. A lot of things were automated. Some of the healthcare systems in the United States have used it quite successfully. All that said, identification in the early phases was the primary use and the most rightful use. And this is what we actually saw during this pandemic, and that is really good because early identification and care is more important in dealing with the consequences of especially COVID-19. So I already talked about EICUs, which help physicians get some free time. In a lot of hospitals, there has been news about New York doctors not getting sleep, not getting rest for several days in a stretch. However, stuff like technologies like electronic intensive care units give some respite. The physicians or healthcare workers, they don't get rest, but at least they could be away from the treatment facilities and attend to some of the personal issues for short periods of time thanks to these technologies. So social distancing again is has become very helpful, particularly in New York, based on my interactions with people in the healthcare there. A lot of them were struggling to get PPEs, personal protective equipments, and if it were not telehealth, there would have been a lot of face-to-face, direct, close contacts with patients, infected people, and a lot of healthcare workers, a lot more healthcare workers would have been infected in that process. So telehealth actually helped with consulting and treatment in a remote setup. And according to even popular media reports, many hospital systems that did not have these technologies and associated infrastructure, those who had it, they were very helpful and they collaborated with others who didn't have it. And some of the systems were not originally developed for this kind of a scenario in mind. I already gave the Chinese example. Uh, Another one is in Houston. I mean, Ethan, emergency telehealth and navigation system. This was developed for the fire department, but it was kind of repurposed to serve better during the coronavirus crisis. In one of my own previous research papers, I had argued that social media technologies are all prevalent, it's everywhere, and it has to be better leveraged by healthcare systems. Not just in advertising. I mean, of course, advertising healthcare facilities is not allowed in beyond a very minimum level. However, I had argued, in a paper with my colleague Dr. Menon, that social media technologies should be deployed in a more extensive and intensive manner in healthcare. And when COVID-19 hit, this was found to be far more of importance. So in the light of, particularly in the US, there are lower thresholds for HIPAA. So patient information is private, but there are some relaxations. And this is the time communication tools and social media tools could be used better. And actually, even with reluctance, because many of the physicians, doctors, healthcare facilities, they were worried even after the relaxation in HIPAA norms. However, some of them did use, Google Meet, Google Hangout, FaceTime, Skype, Zoom, all those technologies for at least for initial consultations and you know remote consultations after the patient is brought back home. So I just, while doing the literature review for the presentation, I have found that according to Deepak, in India, uh, doctors have creatively started using, dermatologists have started using it, for example, for consultations. They use WhatsApp. WhatsApp is a very popular social media format communication tool, which gives both audio and video chat options and file sharing. So, in a large number of medical facilities have capitalized on remote treatment. They have come up with quick fix solutions, not all of them perfect and fine-tuned. Smartphone-based apps were used extensively in the treatment of diseases. And if you see the last part of the slide, you can find a lot of 2020 papers where telehealth processes and telemedicine technologies became of great help in different kinds of disease situation, illness situations, pediatric care, stroke, pulmonary diseases, eye health, eye care, for a lot of different varieties of situations. According to Klein and his colleagues, in a 2020 paper, again, very recent one, telehealth has been employed heavily in mental health care. This is an area where direct face-to-face consultation could better be avoided, even otherwise, even if there is no virus that forces social distancing. Telepsychiatry, telepsychology, teletherapy, teleneurology, and in all these situations, electronic consulting has become very, very normal. And I would make a speculation that this might not go back. This could become the mainstream way by which mental health counseling consultations are made even in the future. And again, as I said, this presentation is part of a larger project, and based on my interactions with mental health providers, this has been really helpful because a lot of patients have become more frank and open in their interactions. They were less concerned about sharing their situations, the distance, the physical distance between the provider and the receiver of the service. That has actually made communication a lot less stressful, and more free. Another thing that I would like to share, or I mean, you already know this, that internet has become the backbone of everything. It has become an essential utility, even in education. Universities and colleges, schools, high schools, even elementary schools around the world have gone electronic. So internet, everyone now realizes that internet should be an essential utility. It should be a free public good. Um, Thankfully, most government subsidized cellular plans had a tier which would, either make it so cheap or free for really poor people who couldn't afford expensive plans. However, in the context of telehealth consultations, what the feedback I received from facilities and service providers was that even when internet was available, a lot of people didn't have smartphones or technologies that were fast enough. Some of them didn't have good cameras on their devices. Some of them didn't have scanning facilities to scan documents. Some of them didn't have good microphones. So it was not the internet, but also the devices, the capabilities of the devices that was also important. Some of the smartphones had got accelerometer, gyroscopes. All those things would have helped the patients provide better data than otherwise. In typical face-to-face consultations, when the patients do not know the language spoken in a country, like, say, for example, a lot of people, minorities that go and seek healthcare in the United States, they don't speak English. So translators were sourced and would have been available for those consultations, but in this case, that was not possible. I mean, if the patient didn't speak English but still spoke a more mainstream language like Mandarin or French or German, auto transcriptions, auto translations were possible like Zoom or Microsoft Teams. They all had options for translations. Some of the doctors that I personally know of, they used Google Translate to interact, the two-way Google Translate to interact with patients. I mean, they went beyond the norms to make this possible. So necessity is kind of the mother of inventions, and here you can see that people come with non-standard solutions. Hopefully, some of these non-standard solutions will be integrated to the mainstream in the near future. Something that is somewhat of shame that, I mean, as someone who is making the presentation from the United States, the US healthcare system has been exposed. It was exposed so many other times in the past, but this time it was exposed very badly, and everybody around the world understood how broken it is. The technologies were very poor, uh, PPEs were not available, not enough rooms to treat patients, not enough healthcare workers. Um, Countries, even developing and underdeveloped countries, had got 5G networks and high-speed internet, but in some of the rural areas in the United States, they didn't have. They still had only dial-up connections. So even as United States did not fare well, we also saw success of some of the countries, South Korea, Singapore, in effectively deploying top-end, world-class, high-end communication technologies and associated infrastructure that they have built for the best use of treating patients in this situation, and also in helping policymakers to come with a better, more meaningful modeling and prediction of how the disease, how the virus is continuing to make its toll. So Taiwan's government likewise made a proactive use of big data to cross-reference its national health insurance database with its immigration and customs database. And as a result of it, it triggers alerts on patients' travel history, and that was of great use. Personal human intervened contact tracing was often of not much use. It was not efficient. It was not effective, but incorporation of big data and AI into that process has made it a lot better. And US did not do that, could not do that, unfortunately. Hopefully, all this will help our healthcare policymakers to open their eyes to what other countries were doing more in a better way. So even for companies like Google and Apple, it took a long time. Even now, they don't have good contact tracing apps, and there is not much of an interoperability between these apps. So someone using an Android device, someone using an Apple device, if they come closer, it's very hard to say if one of them was infected. It's very hard to say they came together. So it must be noted that the deficiencies of the U.S. healthcare system are more related to, or at least equally related to, concerns about privacy when it comes to some of these apps. Of course, the rules were relaxed, but there was some extent, some level of ambiguity as to what was possible, even in those relaxed set of rules. So this is just one of the examples I could figure out again from one of the very recent research papers, Park and his colleagues, 2020 paper. This basically shows the extensive linkages, electronic linkages that made successful management of COVID-19 possible in South Korea. This diagram by means is not exhaustive and fully depictive of the real life situation, but you can see how meticulously the country has planned in incorporating telehealth into their healthcare system. One realization, among other things, that has or should come among the US healthcare circles is that the seamless coordination of testing centers is vital in maximizing the efficiency of testing. This coordination was not entirely lacking, but it was not perfect. It was far, far away from perfection. So there should be a greater level of networking, even though some networking was visible. The silver lining was that this is not impossible if what is needed is the will of the people who are in power. The technologies are there. It's possible to coordinate and provide a far better concerted action if there is a will. Chauhan in a 2020 paper basically talks about the need for this to happen. Educating the healthcare workers, including physicians, including doctors, that was another need that was badly felt in the United States. There were some educational programs like American Medical Association or TRCs, the National Consortium of Telehealth Resource Centers, Centers for Medicare and Medicaid Services, CMS. They all had training materials, but unfortunately, a lot of them were based on books and PDF files, and not very user friendly, and not the best time for healthcare workers to go through tons of pages of information. Authoring appropriate, user friendly, easy to understand educational materials would have helped a lot. So there were new technologies. Many a times, healthcare workers were not proficient in their operations, and those devices just remained in the hospital premises for a long time. Even when a new ventilator was brought in, it had a different user interface, and workers were not able to use them because they didn't know how to operate them. All that said, some telehealth technologies were helpful, like transcription, for example, medical transcription. It was of great help because during remote consultation, Oftentimes, these technologies saved the transcript of the conversation, and that could become the basis for a more clean and pruned official transcript. In addition to that, some of these agencies also organized webinars. I was lucky enough to attend a few, invited to attend a few, and I could see that these were not organized in a perfect way. There were basically some of the presenters were basically reading from the documents and PowerPoint files. But something was better than nothing. Nothing. I mean, it's easier to blame, but something good happened too. There were a lot of really unhealthy practices. If you were using Facebook or some of the social media sites, you could see that there were lots of advertisements online during those days, wherein remote consultations were offered for people in the United States with possibly quacks or real doctors in, say, some other parts of the world, like Nigeria or even Thailand. Some of those were probably certified, genuine practitioners, but there was no authentication. And far worse, the patients could consult with these doctors sitting at the other part of the world, but they could not prescribe medicine that the patients could buy from the United States. They offered medicines, tablets, and capsules to be shipped from their countries, and some of the patients accepted that. I mean, we are still awaiting whether those were genuine or adulterated medicines. So we need to have more regulations, not in a sense of inhibiting innovations and change, but in the sense of closing the loops. Healthcare should be global. Healthcare should be internationally integrated, but at the same time, it should be monitored and controlled for quality. It's easier for people in desperate situations to be fooled by quacks from anywhere, and it's important that the system take care of this and avoid the possibility or minimize the possibility for these things. I know of someone who kept on calling the local clinic, and it was not possible to reach them. Finally, that person took the help of one of these online consulting sites. Luckily for her, it went well. It was a board certified physician, and that person could prescribe some over-the-counter medicines, and they also offered medicines to be shipped, and I'm not sure whether it was received. Coming quickly to conclusion, the COVID-19 crisis threw healthcare into a situation similar to nothing. It was very new, unexpected, totally unprepared. Unfortunately, the United States got a lot of lead time, and we did not make the best use of it. Hopefully, this would become a great learning experience in the next event. In a planned deployment scenario, there would have been numerous rounds of testing, pilot testing for different treatment procedures, different technological use, everything. But in this situation, everyone rose to the occasion. The protectors of quality, the protectors of sanity in the healthcare system, they all understood that something needs to be done, even when on a textbook legal basis that may not be perfect. I'm not saying that is the where things should be always, but that generally was helpful. Some of the medicines were repurposed. Some of the treatment procedures originally designed for different other illnesses, they were repurposed. And generally, it all turned out to be good. Many of the actual uses of telehealth currently are definitely knee-jerk reactions that would probably not have passed testing phase if COVID-19 or a similar pandemic was not in exist. Again, in the United States, these technologies were not available, although not deployed extensively. Some other countries did it well, like Norway, for example. Norway's telemedicine EGDR is one of them. So you can visit their website and you can see that they have done a lot of experiments, and they did not just real experiments but also simulated experiments, and made large-scale deployment of their telemedicine technologies. And this has contributed to better outcomes during COVID-19. So I kind of use this word technology numerous times. The main issue with telehealth is probably not the technologies, at least in the case of the United States. It's the legal barriers. It's the legal systems about what could be done with patient data, what could be done with using different technologies that have not passed the scrutiny of the healthcare officials of different states and different regions. So all those things are barriers. So bottlenecks to telehealth are more about governmental licensing regulations and the attitudes of middlemen, like health insurance companies. I previously talked about telemedicine, and telemedicine actually eases a lot of pressure on the domestic healthcare facilities in the United States. But health insurance companies were very, very reluctant to approve these expenses, even when those expenses were much lower than what typically patients would pay in the United States. So necessity, talking about necessity again, innovations are happening right now, and hopefully they will continue to happen as the crisis unfolds. Hopefully our healthcare systems will become more nimble, more agile, more open to changes, good changes. So talking again about healthcare insurance companies, they also rose to the occasion. Telehealth consultations could now be billed as hospital visits. That's a great improvement, because otherwise patients would do this and the insurance companies would deny those expenses. So in summary, the objective of this presentation was to give you a brief overview of telehealth and how it has become of help in managing the COVID-19 situation. I would argue that telehealth has finally come of age. It's not a stepchild. It's not something that lives at the blessings of the face-to-face, regular, routine, classical healthcare consultations. A more detailed paper based on this presentation, or a more detailed paper based on which this presentation has been derived, is available at the hyperlink given here. I would encourage all of you to have a look at it, or please contact me for getting a copy. Thank you so much for this opportunity to come and interact with all of you during this short presentation. Have a good time, everyone.